Um, Welcome everybody to Pediatric Grand Rounds. I suspect Dr. Hirsch is out of town, and since it's 12:01, I will do the honors of welcoming everybody to Pediatric Grand Rounds, both here in the live audience and on the Zoom webinar. I'll start with a quick land acknowledgement to acknowledge the Ramaytush Ohlone people who are the traditional custodians of this land. And I always say this, there's always some hesitation on my part to do this as sort of a tokenistic kind of thing. But what I really appreciate about the land acknowledgement is that it's really acknowledging the fact that this land the traditional custodians of this land were a group of people who really focused on community. And this is what we're really trying to do with Pediatric Grand Round. So honoring that tradition is part of the acknowledgement in my mind. And with that, I'm going to introduce our speaker, who is someone who's been part of our UCSF community for a long time. And I think that I've been here for a long time by now, but I think Professor Ozer has been here longer. She beats me to it. So Professor Ozer is a professor of pediatrics and associate vice provost of faculty equity Office of Diversity and Outreach. Her training spans health, social, and counseling psychology with over 25 years of research experience in improving adolescent and young adult health and reducing risky health behavior, and over a decade of federally funded research focused on enhancing the diversity of the biomedical, behavioral, and clinical research fields. Her research has included a long history of investigating self-efficacy as an underlying mechanism of personal empowerment and behavioral change. She has served as PI or co-investigator on numerous research grants supporting multidimensional interventions that have targeted clinicians, patients, and healthcare systems, focusing on both implementation and improving behavioral health outcomes, as well as social determinants of health and disparities in delivery of health services. And I just want to highlight that she was a pioneer in this area long before we actually saw a great expansion in the interest on this type of research over the past few years. In recent years, she has actually focused on ways that technology can be incorporated into successful models of preventive care as a means of increasing health equity and accessibility. This includes developing and piloting an interactive behavioral emotional health module for adolescents that can be integrated into healthcare delivery, receiving a National Science Foundation Cyber Learning Award. Sounds really cool. And investigating the effect of a personalized computerized behavioral change system for preventive health. A first of its kind interactive narrative intervention for preventing and reducing risky behaviors in adolescents. Beyond research focused on adolescent and young adult health, she has worked to promote diversity, equity, and inclusion in the biomedical sciences. She served as co-PI on an NIH Science Education Partnership Award to enhance the diversity of the research workforce, was PI on an NIH-funded R1 that focused on enhancing the persistence of doctoral students from historically underrepresented groups to engage in biomedical research careers. And she was recently awarded as PI in NIH R25 to create the first game-based learning environment to introduce students to AI in the context of biomedical careers. Throughout her career at UCSF, she has mentored over 50 trainees and faculty from diverse backgrounds at all levels, including directing research training for interdisciplinary trainees across health fields within the Division of Adolescent Medicine, MCHB-funded Leadership in Adolescent Health program. She currently leads the Adolescent and Young Adult Health National Research Network with the goal of developing a national health research agenda, engaging in transdisciplinary research with a focus on health equity and building research capacity in the adolescent and young health field through research training and mentorship of early investigators. She has served in leadership positions in the field of adolescent health, including a member of the Lancet Work Group on Global Adolescent Health and an elected member of the Board of Directors of the Society of Adolescent Health and Medicine. As I said, this is a really special member of our community who's done so many amazing things and innovative things, and she's going to talk about some innovative things to us today.
Thank you so much. I think you did half my talk there, so appreciate the introduction and also the opportunity to present today. And nice to see so many of my colleagues who have been really instrumental in this work over the years here in the room with me. So today I'm going to focus on innovative digital technologies to improve adolescent and young adult health. I want to first just set the stage. Why do we have a focus on prevention in primary care? And then some background on the delivery of adolescent clinical preventive services. I'm then going to move into talking more about innovative digital technologies with a particular focus on the Inspire narrative-centered behavior change environment, which is a game that we've been developing, and then end with challenges to utilizing digital health technology in adolescent preventive care. So we know that adolescent and young adulthood is a time in life that harbors many risks and dangers, but also one that presents great opportunities for sustained health and well-being. And it's really these opportunities is what has motivated me throughout my career, as well as really what clinical preventive services are about. So when you look at the leading causes of death in the US, these are the latest statistics that we can get. There are about half of the deaths are attributable to unintentional injury, and another 40% combined to suicide and homicide. So really 86% of this pie is preventable. And we know that the majority of morbidity and mortality during adolescence is preventable, but we also know that the behaviors that are responsible for the leading causes of morbidity and mortality during adulthood are initiated during this time. So we've often said that if someone doesn't start smoking when they're a teen or a young adult, they're likely not going to start smoking. So this is not only an important time for prevention for adolescents, but really sets the course really for the trajectory across the lifetime. We also know that co-occurrence of risk behaviors is common. So if a teen is using substances, they likely may be engaging in risky sexual behavior, risky driving, etc. And that most adolescents in developed countries seek primary care services at least once a year. So this has really led to a focus on what healthcare providers can do. And we've often framed this as this is really within the broad sectors of who influences health. It's not a standalone. It's really to support what goes on in other parts of the adolescent's life. And we've also sometimes said that, you know, if a healthcare provider doesn't ask about something, doesn't ask a teen if they smoke or if they're drinking, this also sends a message that, you know, how important can this be if my provider or my doctor isn't asking me about this? So clinical preventive services are services delivered by a provider in a clinical setting. They're designed to either avert or delay onset of various physical and mental health disorders or identify problems or assets early. More recently, there's been more of this emphasis on strengths and assets, which are also really important in delivering preventive services. So as many of you may be familiar, clinical guidelines, the U.S. Preventive Services Task Force are rigorous evidence rules. And then Bright Futures are guidelines that go from birth to 21 years of age, but focus on 11 to 21 for the adolescent age group. While these are evidence-based when possible, they're consensus recommendations. And the primary areas recommended for screening are substance use, reproductive health, mental health, nutrition and exercise, and safety and violence. Now, I lead the Adolescent and Young Adult Health Research Network. Charlie Irwin, Dr. Irwin is the co-PI. This is funded by the Maternal and Child Health Bureau. And it's really a way to set the stage nationally for setting the agenda for adolescent and young adult health. And I just wanted to note in reference to that, that we have some materials on the website. This is just a nice one-pager that tells you what the evidence-based clinical preventive service guidelines are. And then additional details and other documents that really tell you more about recommendations from professional organizations, including the Bright Futures document. So I have spent most of my career focusing on the delivery of adolescent clinical preventive services. Much of that work has looked at and developing models for increasing the delivery of preventive services in primary care. We spent about a decade of collaborative work in Kaiser Permanente in Northern California. Dr. Irwin was PI on the early grants and has been a primary collaborator, and other collaborators from UCSF, including Andrea Garber and Sarah Buckaloo are here in the room. And we really developed a model of providing training and tools for clinicians and more broadly for clinics that dramatically increase screening and counseling across a broad number of risk areas. And enhancing clinician self-efficacy to be able to deliver preventive services to adolescents was one important component of this work. Our work also focused on promoting adolescent behavior change and reducing risky behavior. And again, sort of being able to enhance adolescent self-efficacy to engage in healthy behavior was an important part of this model. And the evidence, though mixed from our work and those of other researchers, suggests that preventive interventions within primary care can result in adolescent behavior change. About 15 years ago, I shifted my work somewhat to really looking at digital health technology, and originally with a focus on improving the delivery of preventive services. This that you see on the screen is Healthy Check, which is a tablet that's a broad screening tool for teenagers in primary care. We originally developed it and as part of research, and then piloted it at that time at the UCSF General Pediatrics and Adolescent Medicine clinics. Adolescents reported high levels of comfort and honesty in using this tool. And more recently, we've updated Healthy Check and implemented in the UCSF Adolescent and Young Adult Clinic. I'm going to be talking more about this a little bit later in the talk, but I just wanted to note that the purpose of Healthy Check was really to also be able to integrate. So it's not just the screening tool. There is the screening tool that adolescents fill out, but then there's a provider, we call it the printout, but a provider form that helps organize the information. And then there's raw data that can be transported to the EMR. Now, as part of the research network, we did a broad review on research on clinical preventive services for adolescents. And there were several really key take-home points. One was the importance of system-level interventions, kind of making linkages outside the clinic with the community. One was optimizing the clinical encounter. And within that, really the need to integrate digital health technology to both improve efficiency and effectiveness. And then we sort of ended, and this was just the beginning of talking about this, of extending the reach of the clinician. And so how can we create opportunities for interactive, innovative technology that can promote adolescent behavior change? So as not news to most of us, technology use is ubiquitous among adolescents. The latest Pew research data says that 95% of US teens say they have access to a smartphone and 90% to a desktop or laptop computer. And adolescence, as I talked about earlier, is this sort of key developmental inflection point in both health trajectories and as well in technology use. So they're strategically targeted for prevention. And this paper, which is led by Allison Giovanelli, who's an assistant professor in our Division of Adolescent Medicine, really focuses on how we can leverage technology to improve health in adolescents using good developmental science. We also collaborated on a review article that looks specifically at what is out there now in terms of digital health technology with a focus on adolescent preventive services, and what are some of the affordances of some of that technology, and what are the challenges. And really this focus broadly on how we can use adolescent young adult facing technology to promote preventive health care. Can we facilitate some of these windows of opportunity that I just described? And then what are potential opportunities through things such as social media, mobile health, wearable and digital devices, and serious games for health. So I'm now going to move and talk more specifically on games for health. And games for health provide interactive gameplay experiences to improve health. So you can see across a wide variety of areas here, there's data suggesting that it can improve health. Games can also engage adolescents in preventive health across a range of settings and time spans. So we use this term for the kind of game that we've been working on, and it's called AI-enabled interactive narrative. And what it does is it integrates AI and commercial game engine technologies. And that generates these immersive interactive story experiences, and they're actually tailored to individual users. So users can be active participants who shape the events and the outcomes of the unfolding narrative. And my colleagues who are computer scientists wrote this paper for JAH, really focusing on opportunities to leverage AI to advance adolescent health through personalized preventive health care. So here's kind of what one needs to do to develop an AI-enabled narrative-centered learning environment. You really kind of create this story world. And then the plot, the characters. And the goal is to really develop something that's then engaging to the adolescents. So we have used this to develop Inspire. My lead collaborator on this work is a computer scientist, James Lester, who's at North Carolina State University. And we were originally funded for this work through the National Science Foundation through a Smart and Connected Health grant, and where we are both PIs. And I bring this up because what you really need for this kind of work is transdisciplinary collaboration. So I am the health part of that, clearly, and about adolescence and behavior change and preventive interventions. And James is the cutting edge technology computer scientist. We're then funded by NIH on an NCI R01 that I'm the PI on, and then also have had additional funding from HRSA. And I want to note in terms of the computer science hat that James heads the North Carolina State University Center for Educational Informatics, and also the National Science Foundation AI Institute for Engaged Learning. We also have many collaborators. We have been a very big team at North Carolina State. There are digital artists, other computer scientists. Here at UCSF, this is actually just the current team. We have had other fellows certainly work with us over the years, and other trainees. But you can see here we have several of our faculty, as well as fellows, postdocs, and our amazing research staff. And we also have been working with a playwright. So we have focused on substance use in the Inspire game. This is because it's strongly related to accidents and injuries. We know that 40% of US adolescents use alcohol, and these percentages are much higher when you get into older adolescents. And about a quarter report binge drinking. And since most adolescents visit a healthcare provider each year, we're going to capitalize on this opportunity to integrate behavioral health into primary care. We also know that computationally enabled models of behavior change hold significant promise for adolescent health, yet there have really been few health information technology interventions for adolescents that have been implemented in primary care. And this extending the reach of the clinician with personalized behavior change also creates opportunities to improve access and equity for diverse adolescents. So the goal of our work has been to design, implement, and investigate Inspire narrative-centered behavior change system. Now, INSPIRE actually stands for Intelligent Narrative System for Patient Individualized Reflective Exploration. And in focusing on reducing risky alcohol use, our goal is to increase self-efficacy for the teens to be able to navigate social situations and avoid risky alcohol use, and also increase knowledge about the effects of alcohol. Our environment uses narrative, uses artificial intelligence planning techniques and game technologies, and allows the opportunity to control characters in the game. So our plot is a mystery. The teen protagonist wakes up in the bedroom after a house party and relives memories of the party. And this allows for navigating social situations with interactive scenarios that are designed to enhance the player's competence and skills. We have been very engaged in iterative development and refinement. And we've had the participation of about really hundreds of diverse adolescents at this point, who have primarily from San Francisco, public schools, private schools, parochial schools, also first generation after school programs. We're currently actually working with a school, high school now in Antioch, who's helping us with piloting. And when I talk about engagement, it's really been from the ground up. So starting with literally going out and doing focus groups and saying, would you want the game to be, you play it first, like a first, you know, you're the player, or you want it third person as the player? What are some ideas for the plot, and sort of floating what our ideas were, character development, the clothes they wear, etc., and then really bringing back a more refined versions for them to give us feedback on. So here's just some screenshots. And the way we've also designed INSPIRE leverages these developmental opportunities in adolescence. And part of this is new attractions, motivation and desire for novel experiences, and then the sort of intrinsic motivation of narrative, having some agency, and that personalized experience. We also really integrate social cognitive theory into this work. And I think this is also a really important part of a transdisciplinary collaboration, is to really, from the ground up, again, you know, what's the theory? Some people have said to me, oh, who does your technology? And that's not the way it's worked. It's really been this team the whole time. They need to learn about social cognitive theory. I need to learn about interactive technology, even though clearly we're the leads in different parts. So the theory really focuses on increasing self-efficacy and skills, both through mastering scenarios, but also through vicarious learning, right? So watching other characters in the game, ability to set goals, and then we've also worked on imparting knowledge. So really the development model has been the inputs, which I've really explained to you, and then just this model of iterative development with idea generation, rapid prototyping, focus group input, and we keep working in that way. Outputs have been really development of the game, really seeing whether it's a game that engages teens, and then working on extending this into primary care. So I'm going to start by showing you, I've been talking about the game. It's more interesting to see something. This is a kind of an intro trailer. It's a little less than 2 minutes, and this is what teens see as an introduction to get them interested in playing the game. See if I can check that. I might need a little help on this particular computer getting it to start. that's our intro. And what I want to now show you is just some examples of the user experience when they're playing the game. So one of the things at the beginning of the game, the player has a chance to set some goals for Max, who is the protagonist. And I'll just show you a little. This is just a video of, a quick little snip of someone doing that phase of the game. First, we identify what's important to Max. And look out for friends. Okay, we also have embedded into the game what we call knowledge objects. There's actually 6 in episode 1. And what they do here is, this is an example of just a screenshot. This is Max. He's walking towards the door because someone is ringing the doorbell. And as he's walking to the hallway, there's a guitar and it has something is lit up. And if he clicks on that guitar, then the player gets this infographic about the effect of alcohol on the brain. And some others they click on keys and they get information about drinking and driving. They click on one of the red Solo cups and they get more information about alcohol content, etc. And depending on what they do there, different things unfold. So if they say, let's do something else, and they stop the behavior, they move on to a different activity. If they don't, and Nikki continues, she actually ends up breaking something in the cabinet. So this is how sort of the way decisions are made, different things unfold in the game. Okay, and then the last little clip I'm going to show you is we have something that's called a self-reflection tool. And the idea is this takes about 5 minutes. It's after each episode. And it's a way to both kind of let them stop and think and reflect back about the decisions that were made, as well as how to really translate or generalize this more to their own life. So one of the things that happens is that when a teen makes choices, like right there that I showed you, if they'd made a choice to say, everything's fine or whatever, they actually see the goals that they set for the character. Here it's stay in control, don't get into trouble, look out for your friends. And they can click on which goal they think their decision supported. So it's a way that kind of encourages stop and think, some self-reflection, both in the game, but now this gives them a chance to go back and look. So as I said, this takes about 5 minutes. This clip is about a minute, but it just shows you a little about the self-reflection tool. Next one. There you go. There's this strategy of thinking smart, and it kind of reinforces the strategy. It has kind of Max narrating how, I found it helpful to use this strategy. I set goals, so this is things that the player had done. These were the goals for the evening. How did Max's choices support the goals? So it actually allows them to say how many times did they actually make a decision that supported the goal. And then actually go back through the various choices that were made that supported the goal. Declining taking a vodka shot, etc. Allows them to sort of click on what approaches might be most useful for them. To write in other strategies they might use. And then where might they use this strategy that they learned? And the other thing, though, then this is where we have sort of the AI-driven component, is that each one of these reflections is individualized because every teen may pick different goals. They may make different choices, but what they get back as their reflection tool is what they did in the game. Okay, so looking at what we're seeing from teens playing the game, first of all, we have something we use that's called computerized trace log data. Now, as a psychologist that's really used to self-report data, this is pretty interesting stuff. It's a form of what's been known as sort of stealth assessment, where you can leverage kind of fine-grained evidence from game trace logs, and it's used in other kinds of research to infer learner knowledge, skills, the kind of things you can just pick up from the way they're playing the game versus needing to, give them a quiz or something at the end of the game. So as adolescents explore the narratives, logs of their in-game behaviors are time-stamped and recorded. And so logs can really sort of provide a view of their problem solving and some of their self-regulatory processes as they play Inspire. We are able to produce descriptive statistics that summarize adolescents' usage. So we know the time playing Inspire. That's why we know it's an average of 20 minutes. We also know how long it takes them to play various components of the game or how long they spend looking at something. We know the decisions they're making and their choice points. And again, how long does it take them to make a choice? The goals that they're choosing, the knowledge items that they're clicking on. And if they click on a knowledge item, are they actually reading the infographic? Are they taking 2 seconds? Or are they taking 30 seconds? All these kinds of things. So then we also have traditional self-report data pre and post. knowledge about alcohol and its effect on adolescence, self-efficacy to avoid risky alcohol use, as well as self-reported alcohol use, and then a sort of established user engagement scale that's often used with games, that they report how engaged they were in the game, and then their ability to relate to characters. So what we found is both our trace log data and the adolescent survey responses indicate high levels of user engagement, and that we've created a narrative-centered behavior change environment that's engaging, believable, and relative to teens' lives. This was a broad paper we published on the development and the engagement. Marianne Pukash, who was a postdoc with us, piloted this with teenagers with ADHD. And then just recently, we had a paper in JAMA that was led by Anushka Sinha, who's a fellow with us, and we'll happy to report will be joining us on the faculty. And she really focused on how the interactive game like Inspire really promotes narrative play. So we're also seeing preliminary findings that Inspire led to increased self-efficacy for handling types of scenarios, such as controlling a party, looking out for friends, avoiding drinking games, as well as increased knowledge about the effects of alcohol. Carlos Pinilla had a diversity supplement on the R01 to really focus on health equity and testing interventions among Latinx youth, and he's been engaged in the development piece in terms of engaging adolescents, and is currently examining both the engagement and the effects of Inspire on alcohol use among Latinx adolescents. So as I mentioned when we started, Inspire is developed to link with primary care, really to be a clinician extender. The trailer I showed you is what teens see when they come for a primary care visit, if they're eligible for Inspire. And then there are these narratives that are really meant to be linked to in primary care, but done at home or not in the clinic. There's 3 at this point, and then there's the reflecting tool after each one. Dr. Sarah Buckaloo, who is our co-investigator, who's really the clinic lead, and we've been using the Healthy Check screening tool, which I introduced earlier, as a way to allow us to identify patients who are eligible for Inspire. So the criteria is they're between about 14 and 16 years of age, and they have endorsed alcohol use when they fill out Healthy Check. And so kind of keeping this consistent with clinic workflow, Healthy Check informs providers of patient eligibility, and there's also information that can automatically go in the after visit summary to tell patients who are eligible about Inspire. So this is just an example here of Healthy Check. You can see it assesses a wide variety of areas. This is for substance use, and there's a couple of questions that are screeners. And then if they say they engage in substances, they're given the craft for much more detailed information. We have something very similar with depression, emotional health, the PHQ. They get 2 items, and then if they, it will automatically kick into the PHQ-9 if warranted. So this is a view of the Healthy Check dashboard, which can be accessed via Apex. And everything here that says view was part of our original Healthy Check integration, in that clinicians can click on that and see the provider form and see the raw data. But now we've added a column that says Inspire and eligible. So what this means is they are able to see very easily if a teen is eligible to then link to the game. Here's an example of a Healthy Check screening report. You can see a lot right at the top quickly with the PHQ-9, also with craft and substance use. And if a teen is eligible for Inspire, it will also say there that they're eligible for Inspire. And then you can see this is this model of reinforcing the healthy behaviors, and it's organized for the clinician where they've, their various responses there, and then where there are areas where there's potentially more concern and need to talk to the teen about. This is just the rest of the areas. And then we have something that's right here at the bottom of the form, which is sample brief messages. And these are brief messages that the clinician can use to talk to the teen about these areas. So there's also a Healthy Check has a raw data report, and it has these buttons on the side which enable this to be exported into the electronic medical record. But for purposes of Inspire integration, you can see the bottom button now says Inspire eligible, and that means that there can be text if you push on that button that goes right into the after visit summary that tells teens about Inspire. And that's also the text here that's at the top of the report. And actually the teen, by the time they come to talk to their provider, if they fill out Healthy Check and they're eligible, it automatically tells them at the end that they're eligible for this study and allows them the opportunity to click on the trailer. So again, it's sort of this connectedness to care is really important if we're trying to integrate something in a way that's as seamless as possible. So that's just the after visit summary. So in summary, about Inspire, a first of its kind interactive narrative intervention, shows promise as a learning environment for adolescent preventive health care. As I just described, we're piloting in a model for integrating it into the clinic. And our ongoing research will provide additional data to further examine changes in adolescent self-efficacy and the effects of Inspire on adolescents' alcohol use. And just before ending, I want to step back a little bit and just talk about some of where the challenges are with extending clinicians' reach through technology. We need evidence still on, this is broader than Inspire, but just the field in general on feasibility, acceptability, efficacy, behavior change. And there are really significant challenges with privacy and security, the reliability and accuracy of some of the digital health interventions, as well as the connectedness to care, which we've often, because we have these great collaborators at UCSF, really been working hard to develop that component. Just at the end of the summer, there was an online report that just came out on the health and safety, a report on online health and safety for children and youth. This was appointed by the Biden-Harris administration, and it's an interagency task force, and it's definitely worth looking at. This is quite broad about health and safety for children, and there are clearly ethics related to AI specifically to ensure that AI's impacts are beneficial for adolescent health. These include bias, equity, and inclusivity, accountability and trust, maintaining privacy, user consent and ethics, related to AI and human research. And this paper that Alison Giovanelli is first author on also has a lot of it. The second half of the paper really expands on many of those issues that I've just raised. And then we also had, as part of a special issue for the Journal of Adolescent Health that we organized, actually the co-chairs of the Academy of Medicine AI report in healthcare actually wrote this commentary for us that really focused on equity, inclusivity, and innovative digital technologies. I also think it's really important that we focus on clinician education about AI and its implications for interventions in primary care, develop best practices for utilizing this kind of health technology, and how do we maximize potential and minimize risk. So in conclusion, this transdisciplinary research on AI-driven environments such as Inspire really create new opportunities for improving adolescent health. And I think it's important to continue to focus on these collaborations that involve health researchers, computer scientists, and healthcare providers so that this research is theoretically grounded, it's clinically relevant, and it's technologically innovative. So thank you. Any questions? Comment? A lot. Yes, Dr. Garber.
Great stuff. Very exciting. How do you keep the game fresh? Goes through this long process, ability and so on, and training. Teenagers, like even probably the language they use, the conversations, or like the clothes they're wearing.
Yeah.
Do you have to update those?
Yes. So the question was, how do we keep the game fresh over time? And my answer to all that is yes, that's something that we need to think about. And it's funny because you mentioned the clothes. And when I look at the clothes, I'm thinking, oh, the pants are really tight now, and that in this, and that they're not so tight anymore. And so, yes, things have definitely evolved. I would say, though, what's so much work is creating this sort of the technology, the infrastructure to be able to do this. And actually, it's not that hard to change other parts of it. And because we've been working on this for so long, I can now say it is a whole lot easier now than it used to be. So when we first started, it was a big deal to translate what a teen told us in feedback to the game itself. Now there's these things called using ink and using, as I joke, I sort of feel like I have a master's degree in interactive technology now, but it's much easier to make those changes. So yes, we have to keep doing that. And in fact, we've been creating new episodes. So the new episodes are more current than the first episode. But we can go back and we can make revisions. And I also want to say this is a prototype, right? So this is the kind of thing that people could use for a different area, a different health risk behavior, et cetera. And once a lot of this, even the story world, some of the illustrations, it's very easy to change narrative. It's a little harder to change, characters because you need digital artists and things like that. Yeah. Yes.
So also want to say just really cool stuff and amazing amount of work, I'm sure. I had a very similar kind of question, but slightly different. Having just had my 17-year-old niece stay with me as a otherwise child-free person for a month this summer, it's a whole experience. I learned a lot about, there are the cool kids, the not so cool kids, and what certain groups of kids wear. It really tells you which sort of clique they belong to. And I don't think the alcohol use is by only one clique versus another clique. So how do you make this appealing to teens who so clearly identify with their own kind of?
Yeah, I don't know if everyone can hear the question, but it was about how we make this appealing to kind of teens who have different cliques, different kinds of, kids they identify with. Well, partly what we tried to do is to create different kinds of characters. And so that teens who did identify in different ways and have different kinds of characters could relate. And that was part of why we brought this to so many teenagers in terms of the characters. And we have a question at the end of every post test that asks if they could relate, just to your point, to a character or to characters. And about 75% of them say they can. It may even be slightly higher than that. We also asked them, who do they play the game as? Because we also wondered, are they just going to be like, I'm just going to be hitting on whatever. Let's make sure Nikki breaks something. Let's make sure. And most of them say that they play as themselves. So they really are kind of thinking, what would I do in that situation? So those are the kinds of things we've also been thinking a lot about. We now have in the third episode a character who they refer to as they. We didn't have that earlier. We started this a while ago, but some of the teens said, I want to be able to relate to a character in there, and so this is how this sort of evolves over time. Yeah. Any other comments or questions? Looks like something. Oh, I don't know if that was a hand in the back.
I think you talked about it very interesting. I was wondering if you considering distribution methods of care provider? Because I understand you're trying to aim this at young adults rather than tell them a young adult. I've observed a lot of their late 20s often have primary care coverage while going on to college or while starting a job. Doesn't have that first job.
Yeah.
And
Yeah, I'll answer that one, and I mean you might have a different one too. But yeah, it's a good question. Um, so a couple of things there. Let me talk about the age group, and then let me talk about sort of distribution. The age group, this particular game is targeted towards sort of that early high school experience and the onset of starting to use alcohol, right? Like in a party scene, that kind of thing. So I've always thought it would be great also to have one that's as you're starting college, right? Because I know there are these requirements oftentimes that, you know, you have to take this alcohol substance use training. And from what I've heard, a lot of them are not very engaging. So I thought that that actually could be a really good window now that we've created a version like this to do something like that age group, right? I think you could do it for different age groups, but I would say, you know, if you're 18 or 19, this is probably not going to feel as relevant to you as if you're, I mean, sort of our sweet spot is about 15. I would say that sophomore in high school. So that's the first part. We frame this really as a primary care because, you know, for many reasons, that's my background. How do we use primary care? How do we extend the reach of the clinician? I certainly don't think that is the only place that it could be used. It could be used in a variety of different ways. And we are actually doing a collaboration right now with Boston Children's Hospital, Harvard, and they are doing a substance use intervention for kids with ADHD. It's not in primary care. It's a sort of a, you know, something else. And we have just made videos of the game because it was really hard to have them sort of linking because we're not in a place yet where it's just public access to link and play the game. And I'm really excited about it because it's both, I mean, it's many, many videos because depending on decision points, they actually go into a different kind of video. And somehow, which I don't even know how, but you probably do, through YouTube, we're actually also able to do it where there's 3 places where they're actually making a choice. And then so that they actually have a little bit of ability to engage. And then depending on the choice, it kicks into one of the videos. So they will have some participant agency. And we're excited about looking at the effects of that to see, is it very similar to actually playing the game? So I think there could be a lot of opportunities. We also are engaging teens who've used alcohol because this is a research project and we want to see if it has an influence on their alcohol use, right? If they've never used alcohol and then they self-report that they continue to never use alcohol, we don't know if the game did anything. So that's why we're saying they have to have at least said that they're using alcohol. But in reality, I think it's a great prevention tool. I don't really think you certainly don't need to have used alcohol to play Inspire and learn from it. So I hope I answered those questions, but you could help us with a young adult game. Yeah. Yes.
I had a question about, like, you mentioned the AI component, and I feel like when I hear AI, I kind of like, you know, kind of clench my teeth a little because I feel like it can be very scary. So I'm curious, like, how you're thinking about like leveraging it as like a powerful tool for how it's already being integrated in what you do versus like the risks with it, right? Like, I think there's like been stories of like kids saying stuff to AI and then becoming like really attached to it and like you know, instances like that. I don't think that's like something in this, but I think how is that something you're thinking about, like, especially like sometimes kids are very questionable and like what AI and how it like informs them and things like that.
Yeah, and I think you know, as you point out, there's really different. I mean, AI is being used in so many different ways, and that's why at the end I kind of brought up, you know, here's concerns and here's things we need to think about. I think with this game, it's AI driven. And the reason it's AI driven and it's called an intelligent narrative system is because of the ways the computer can scaffold, can make decisions, can, depending on, can personalize. So I think those are the ways in which we're using AI, can come up with a reflecting tool that's all about what you did and not somebody else. So I still think that the way this gets implemented and the way that the data is used and the privacy and security, I think that's really important, regardless of how much, there are examples, of course, that are much more extreme of the way AI is being used, but I think that we have to be cautious as well. And we have to think about that in the way in which we think about the next step, which might be broader dissemination. Yeah. And we'll know more, I think. I mean, after this clinic implementation, we're learning a lot. And I think that will be really helpful to us in kind of thinking about what the next phase is. Yeah. Thank you all for your questions and engagement.